Yeah, thank you, Ore. Wow, Femi, you're looking great.
Yeah, I just want to look different. It's part of all this mindfulness you are teaching us and enjoying yourself.
You know, for a microsecond, I thought it was a hairdo. I thought it was a haircut. You know, and now I think it's. But now I think it's your cap. All right.
Yeah, it's a cap. Let me just.
Yes, I'm doing a Friday wear too. You know.
Okay,
you can see my pattern.
That's good.
All right. I think we're going to, start right away. I want to say a pleasant evening to everyone who has joined us. And probably you're joining us from outside Nigeria, outside Africa, and you're in a different time zone. I want to say a pleasant morning or afternoon to you as well. Thank you so much for joining us. This is Lifestyle Champions International. Here we encourage you to make healthy lifestyle choices every day so that you can reduce your risk of lifestyle-related diseases. And there are so many of them. They are more or less becoming pandemics within our climate. And we're going to have a panel discussion. You know, we love having what we call BYC panels, booster confidence panels, so that we can encourage you, we can motivate you, we can help you to see that there are some things that are actually possible. Sometimes we have testimonials, but today we're going to have an expert talking to us on how chronic lifestyle-related diseases can affect our eyesight. So I'm really glad that you're here. My own name is Moyosori Makinde, fondly called Dr. Uri. I would really love it if you could introduce yourself in the chat box as well. You can, introduce yourself by name and tell us where you're joining us from. So I'm so excited this evening. The last two sessions we had were actually on Instagram, but I've been getting more people telling me that, oh, I prefer Zoom. So we're back to Zoom this time around so that we can get more of our members, to attend. So welcome. I'll be looking out for our names in the chat box so I can recognize you. But let me try and see. Okay. Can see quite a number of people in the house. Welcome. So what are we talking about today? Like I said before, we're talking about chronic lifestyle-related diseases and your eyesight. And just a few days ago, I think that was last week, we marked the World Sight Day. And our guest is going to tell us.
That's my network. Always network got frozen, or it's mine.
Our lifestyle or from our habits, things that we have practiced over the years. And many times we treat the disease, but we don't treat the cause of disease. And one of the things that we want to do is to get to the root cause of disease and see how we can prevent it. I think that's what is really beneficial for us. So we don't want to wait for a wake-up call, because I discovered these days that people wait for the wake-up call before they, get a call to action to say, okay, it's time for me to change my habits. I've been drinking this, I need to stop. I've been eating this, I need to stop. I don't sleep enough, probably. I need to sleep more. Why wait for, life to give you that, how would I call it now, that wake-up call? We don't have to wait. You can live, a healthy lifestyle on a regular basis and reduce your risk of disease. And, I tell people that to become a lawyer, you don't just wake up and say, I'm going to become a lawyer, and you become a lawyer. In the same way, you don't just wake up and say, okay, I want to be well, and wellness just comes. It doesn't come out automatically. Even for those of us who believe in divine healing, God still wants us to view our bodies, as a vessel that he wants to see, in a good state. So our bodies are the temple of God. It's been bought with a price. We must honor God with our body. And if we honor God with our body, then we'll watch what goes into our mouth. We'll watch our relationships, with people. We'll take care of our emotions. We'll take care of our mind. We'll take care of our heart, and so many other things like that. So let me not belabor you with so much of an intro. I have someone very special in the house tonight. He's a friend, he's a colleague, and he's been with us, I think sometime last year. He was also with us. Let me just try and get his bio. So he was with us last year. I'm trying to remember what the topic was last year, but I remember that there was something that he taught us last year. I think some of us, we should do that this year, looking away from our device every now and then. So in case you see either myself or our guests, just looking away from the screen as if we're not looking directly at the camera, know that there's some intentionality about that so that we can reduce some strain and stiffness in our eyes. So I hope I got that right.
Yes, we can start on that note. We call that 20-20-20 rule, 3 20s. 20-20-20
right.
rule. So after 20 seconds, 20 minutes of looking at your device, you look away for 20 seconds at an object 20 feet away.
Right. Okay, so can I spotlight, can you help me, or can you help me to spotlight Dr. Femi while I read his bio? It's a short bio. All right, so we have our guest in the house tonight. His name is Femi Ibrahim. Dr. Femi Ibrahim is a board-certified ophthalmologist. He's currently an associate prof at... he's currently an associate prof at Orota College of Medicine and Health Sciences, Asmara, and a consultant with the National Eye Referral Hospital, Asmara. I think you might need to give us an update on that, actually. He has special interest in public eye health, retinal diseases, health system strengthening, and lifestyle medicine. Fondly known as Dr. Femi, he's married to Temi Tokbe and is blessed with 3 children. Okay, so all right, I would really love it if we could mute ourselves as we come into the chat room. Thank you so much. So let's welcome Dr. Femi as he talks to us about chronic lifestyle-related diseases and our health. I'm going to be asking him a few questions, but thank you so much for that intro and for reminding us, about the 20-20 rule and how we should look away and for how long and to what distance. Welcome, Dr. Femi.
Thank you very much. Welcome everybody too. Thank you for coming on board.
Thank you so much. So I can see some. Okay. I don't know what's happening. We seem to be getting a lot of background noise. Okay. All right. So apologies for that. I actually wanted to just acknowledge the chats that have come in. We can see Adeba Mowo, Oluwakemi, Gladys Uhurugu, Funke Aleshinloye, Adedutan Oyegoke, Titi Atashili, Mr. Balogun. Thank you so much for being here. I recognize you. But let's go right into the meat of our discussion tonight. So my first question for Dr. Femi is, we recently marked World Sight Day. What is the significance of commemorating this day every year?
Okay,
is there anything that we need to look out for every year when we mark? the World
Okay, the
Sight
World
Day?
Sight. Okay, so the World Sight Day was a day set to celebrate vision, eye health. It was set up by International Agency for Prevention of Blindness, which that works hand in hand with the World Health Organization. So it's usually done on the second Thursday in October. Second Thursday in October. So it's not a fixed day like you have for diabetes, I think November 4, HIV, December 4. So it's the second Thursday. So you might see it might be 10, it might be 12, it might be 13. It was 13th of October this year. I think last year was 12th of October. So it's the Thursday precisely. But when people celebrate, they could do a whole week celebration or do it on that particular day. It's a day to create awareness about eye health, visual impairment, and blindness. To make people
Have we lost?
Okay, I think the network has fluctuated for him. Let's give a few seconds. I'm sure we'll get him back.
Okay.
Oh, I think we lost him. So welcome. Okay, you're back. Okay.
Sorry, I think it's my network. Okay, so like I said, 70 to 80% causes of blindness and visual impairment is avoidable. So things like vitamin A deficiency, measles, keratopathy, trachoma, cataract, uncorrected refractive error. They are things that they are treatable or preventable. And if we take care of this, a lot of people will not be blind. Cases and situations where people have glaucoma, diabetic retinopathy, these are partially preventable. If you screen people regularly at particular ages, you are likely going to pick them early and treat, and people will not get blind. There are other things you can't do anything about, genetic cause of blindness that you can't do anything about. But those percentages are less than 1%. And if we also prevent people in having trauma, so people that are working that have occupational hazard of trauma, welder, carpenters, mechanics, battery chargers, if they take necessary precautions and preventive precautions, they will not have trauma to their eyes. And then you can prevent blindness in happening. So it's also to make advocacy. Like this year in Abuja, the National Eye Health Program, part of Federal Ministry of Health, actually went to the House of Senate to talk with them and also to check their eyes. And the focus we had in the country this year was love your eyes, save lives. So in every state, there was screening of the drivers, commercial drivers, whether drivers of vehicles or motorcycle. This was done to create awareness that they need to check their eyes regularly. And also advocacy with FRSC to ensure that they do proper check for people before they give them driver's license, because this is very important in the country. So it's a day to create awareness. So you see a lot of jingles, a lot of radio talks, TV talks, marches around, and then people are aware. Then it's also an opportunity to do free screening, or in the process of creating awareness, free screening to people so that they can check their eyes, and that can also help to pick some people. But there has to be a routine, systematic way of, checking people's eyes so that people can it can pick many things early.
Thank you so much for throwing light on the World Sight Day. I'm sure some people have not been too familiar with it. And it's good that we know that advocacy is ongoing so that we can reduce, the causes of blindness and increase people's awareness to know that they need to screen. I don't know how many of us have gone for an eye screening this year. If you've gone for an eye screening this year, just please engage with us. Can you just put your hand up in the chat box? I just want to know how many of us, out of 30, I think we're about 30, okay, but 36 here. I really want to know how many of us, have done an eye check this year. So you could just put your hand up and, we'll see what the numbers are like. So now, I'm glad that there are some causes of blindness, or other eye problems like cataracts, that are preventable. You mentioned that there are some that are preventable, some are genetic. We can't do so much about them, but well, if early screening comes into place, then we can, do something about it. So now these ones that you've talked about, that you said they are preventable, I believe they are what we call the lifestyle-related diseases, the chronic lifestyle-related diseases, and that's why we're here. We have quite a number of them now. We have diabetes, we have hypertension, we have high cholesterol. Do these things really have an effect on our eyesight and our vision? We're talking about loving our eyes. How do these illnesses affect the vision, and how soon do they occur? Is it something that can occur within a very short time? I discovered that I have high blood pressure now, and then in another 1 month, it's possible that I could be having an issue with my eyes. How does this thing happen? And what are the things that we need to look out for so that we don't fall prey, to this problem with vision?
Okay, thank you. So these three you mentioned, cholesterol can, in some cases,
Hello, Femi. Hello, Femi.
Watch and wait. In some cases, that expensive. Yes. Can you hear me?
Yes. So it was breaking up. We didn't get the last thing you said.
Okay. Just 1 minute. Is it better now?
Yes, it is.
Okay, so I was talking about diabetes, hypertension, and cholesterol. I'll try to be slow. I think if I speak too fast, you might not hear clearly also. So I said these diseases can cause blindness on their own, especially if attention is not paid early to this. So usually the advice is that patients who have this disease, they should follow their doctor's care. And all of them should come for an eye checkup, even a diagnosis. Okay? Because if they don't, if we wait, especially for diabetes, if we wait until the person has complaints about vision, we are far behind, because there might have been complications that could have been remedied before. And like we know, prevention is better than cure. If you prevent things, you spend less, or even if it appears you're spending a lot, on the long run, you save more, whether disability years or cost-benefit analysis, you still save more than when you are treating the problem. So what this disease causes is actually they affect the eyesight in the posterior segment, more in the retina. So diabetes can result in what we call diabetic retinopathy, where there will be bleeding and changes that will occur in the retinal blood vessels as a result of the diabetes. Hypertension does the same, and cholesterol does the same. The three of them, they predispose people to developing what we call retinal vascular disease. So they can cause stroke in the eye, the three of them, because
wow.
they have
could you come again? Come again on that, please. Did I hear you say stroke in the eye?
So, yes, they can cause stroke in the eye. That's the way we have to describe it to patients. The person just noticed suddenly he cannot see. Suddenly he cannot see because the central retinal artery or central retinal vein, they bring blood into the eye and take blood out of the eye. They are blocked completely. So there's no blood supply to the eye, or the blood supply in the eye cannot flow out. So these will create sudden loss of vision. And when this happens, in 30% of cases, they might get their vision back near normal. But in the remaining 70%, the vision will be very bad. And there's nothing much you can do. You just have to ensure the person doesn't go blind completely. So that's the big problem about these three diseases. So it's important that when people have this disease, they properly follow their doctor's care, because a patient with diabetic retinopathy, it's because there's poor glycemic control, and it results in the cascade of events that affects the changes in the blood vessel that result in leakage in the retina and create problems. Yes, we can do something. We can give some injections in the eye, give laser treatment, do surgery, but we can't get things back like it was. We'll still tell the patient, get your sugar control better, or get your blood pressure control better. Okay, so it's very important that people follow the care. The other thing is, for example, for diabetes, which is, I think, out of the three you mentioned, diabetes is a very lethal weapon or lethal disease that causes a big problem in the eye. Usually, especially for type 2 diabetes, our diagnosis, 5 to 10% already has retinopathy. Because like, Ray, and other people that are here, making diagnosis of diabetes is not at that spot. That is when we're picking it. It could have been there for some months to years, but something happened to that person that make us, let's check the sugar, or let's do the fasting blood sugar, and then you found out the person has diabetes. So the changes is already there in the eye. And sometimes some people come to our clinic, we just look at the back of there and says, you have diabetes. We say, no, I don't have. Okay, go and do a fasting blood sugar. And then there is diabetes, because the changes are there. They are peculiar to diabetes. You can't, it's diabetes. And I've seen quite some patients like that. And they came back and like, you're a wizard. I said, no, the eye does not tell lies. Even if you don't tell me what is happening in your eyes will not tell lies. I will see the telltale signs of everything that has happened in your eyes. So this can happen, and this is a preventable cause of blindness. If people do routine checks, or once they are diagnosed, and we do this education both to patients and to the other physicians, when you make diagnosis of any of these chronic lifestyle diseases, please refer them to the eye clinic, and let's do a baseline. The baseline is there with us so that if the patient has any other problem, there's something to compare with. Or we might pick a problem early and we can start treatment early, such a patient. And you can prevent them in becoming visually impaired and blind. So that's very, very important in that. So diabetes also can cause cataract, or people with diabetes, they have increased progression of cataract. So you see young people uncontrolled for a while, and then suddenly they say they can't see and they have white cataract. Okay, so it also makes it progress faster in them. Yes, I mentioned about hypertension. Cholesterol takes a while, but it can really create a big problem, vascular stroke in the eye. And there are people that have the three combined. So it's like putting fire with explosion will be catastrophic in such a patient. It's important that patients are educated properly, and they also come to the clinic to be checked.
Wow, this information is quite crucial, You know, we on our platform, we have a mixed group of people. So we have doctors, we have people who are non-medics, laymen, so people from different walks of life. And so this message is for every one of us, even for those of us who are medical practitioners. I don't know how many of us have checked our eyes. You know, I don't know when last you had a fasting blood sugar done, when last you checked your lipid profile, but I'm learning more despite what I know. And so we can see that a baseline assessment of your eye is always important. If you've been told at any point in time that you have a high blood pressure, or that your blood sugar was high, or that you had a high level of cholesterol, then you need to find out from your physician, don't I need to get checked? Do I need to go to the ophthalmologist so that they can look at the back of my eye? So in case you're wondering what the retina means, the retina just means, it refers to the back of the eye. And we have a lot of important blood vessels, you know, over there. And once anything goes wrong with those blood vessels, just like Dr. Femi said, you can have a stroke in the eye. And I'm sure nobody wants to experience this, because I was just imagining that there's a lot going on, you know, across Nigeria, not only in Nigeria, but just across the world, you know, but people are able to make their way because they can see, you know, but you can imagine not being able to see, even in the midst of, you know, the seeming very gloomy situation right now, economically and all of that. So it's good that we pay attention to these things, because wellness doesn't just happen. So I want to say a warm welcome again to everyone joining us tonight. I can see one of my mentors and teachers, Dr. Stephen Johanna, in the house. Yeah, welcome, sir. Thank you for joining us tonight. I can see many more people in the house. We'll still recognize you later. So I have another question. And if you have a question for Dr. Femi, you can even start typing it into the chat box. You can start typing it into the chat box. So another question I have is, what are the numbers like? You know, when we're talking about maybe diabetic retinopathy, for example, hypertensive retinopathy, is it something that's common in Nigeria? I know you said something about blindness maybe occurring in maybe 1% of people that have a certain illness, but how common really, you know, are these lifestyle related causes of diabetes? I mean, how many people do we see coming down with diabetic retinopathy, for example?
Okay,
do we have numbers?
Okay, so I might give you in percentages rather than actual numbers. You know, when we talk about numbers, most of the time they're extrapolated from data, and if I have numbers, it will be outdated by now. But first of all, about 45 million people are visually, okay, let me not put it that way. They are blind. 45 million people are blind all over the world. But currently, there is 1.1 billion people that are visually impaired all over the world. So 1 in 7 people all over the world, if we assume the world is 7 billion, which I think is more than that now, 1 out of every 7 people are actually visually impaired. That means when they do a visual acuity, something, the third or 3 lines, or the third line of that visual acuity chart, they can't see it well. And it's noted that giving spectacle to about half of this will actually help a lot to make their life better. Okay, if we come to Nigeria, about 4 million people are actually blind in Nigeria. Cataract account for 50% of this. Then you have glaucoma, which account for 16%.
I'm actually writing this down. You know, these numbers are, you know, I think it's a bit alarming. It's alarming. You know, even in Nigeria, we have 4 million people who are blind. and cataracts accounts for 50%. And he said earlier that diabetes is one of the major things that leads to a very quick progression of cataract. And then he also mentioned glaucoma as being responsible for 16% of the cases of blindness. So 50% from cataract, 16% from glaucoma. And both of these are known to result from diabetes. And diabetes is actually causing a pandemic all over the world in itself. So it's staggering to know what these numbers are like. And I'm sure that today we're going to pay more attention, today onwards, really. I believe that we're going to pay some more attention, to our blood sugar, because if you're paying attention to your blood sugar and it's well controlled, that means you're going to reduce your risk of developing cataracts later, or or a retinopathy. And when we're talking about a retinopathy, that means damage to the retina. I can't see Dr. Femi. Are you there?
Yes, I am. Sorry, my network.
Okay. All right. So
my network has been active.
Okay. So thank you for sharing.
So diabetes is on the increase. So it's also.
Go ahead.
Sorry. Yeah. So yeah, I'm changing my network to another one. Okay. So diabetes is on the increase. So we also know that the retinopathy will be on the increase. So the thing that has been found for diabetes, for the retinopathy to happen, the longer the duration, the more likely there will be the retinopathy changes. I'm talking about the retinopathy. Diabetes causes other problems in the eye, affects the lid, can cause cataract, or progression of cataract is faster. But the retinopathy is more problematic because people don't see it from outside until we look at the back of the eye before we can see the retinopathic changes. And in 20 to 30% of people that have diabetes, they will go blind, and there might be nothing anybody can do about it. But if they have good glycemic control, they are doing regular checkup in the eye clinic, there's some treatments, giving them injections in the eye, giving them laser treatment, we can prevent them in becoming blind. But a lot of times people come so late that even if you offer surgery, so we'll do some surgeries, offer it to them, they might be able to move around, but they might not really be happy with their vision. So it's teaching time saves life. And what I usually tell patients, and I'm telling everybody now, is as if I'm begging everybody, check your eyes. Whether you have any complaint or not, once a year, we advocate that people check their eyes, even if there's no problem. Once a year, especially if you're 35 years and above, you should check your eyes. There are a lot of diseases that before we say 40 years, but now many things are coming early nowadays. So 35 years, once a year, please check your eyes, preferably around your birthday. You don't forget your birthday. Nobody forgets their birthday, even if you are busy. So around your birthday, a week before or a week after, schedule an eye check, because that will be very good, prevent you in a lot of things. Secondly, if there's any family history of eye problem, you need to check more often, or at least once a year, you need to check. This is important. Some people have a family history of glaucoma, and they don't check their eyes, and by the time they come, it's late. So it's important we do that. And if you go to the eye clinic, please, yes, there are many people in the eye team. You have the ophthalmologist, the optometrist, you have the ophthalmic nurse, and the optician. People know the optician more and the optometrist more. they can diagnose things, but the issue is that the optometrists, they call themselves primary eye care physician anyway. They can pick eye diseases, they can order glasses, contact lens, but there are some diseases they can't manage properly. And so it's important to see an ophthalmologist. Definitely for surgeries, they don't do surgeries. In some countries, they do laser treatments, but that is if it is in their scope of work to do. The others support, the opticians are just only to cut and fix glasses. So it's important to know who you are seeing, because that's very important about the care of your eyes. So this is very important. So it's not just only glasses, because a lot of times people come to me, they just want to see, and they're like, can't you give me glasses? And I'll just say, it's not just about glasses. Glasses is if there's a refractive error. There can be, you can be wearing glasses, seeing everything you need to see, and the eye can go blind tomorrow if there's an eye disease that it's not taken care of. Okay, so it's not just about glasses, but there's a lot of view in the community that just give me glasses, that will solve all my problem. Or if somebody is giving glasses, it can see better, he believes it doesn't have any other problem. So that's very important. For those with lifestyle diseases, once they see the doctor will let them know when to come for follow-up, whether once a year or twice a year or 3 times a year. So for example, there are some people with diabetic retinopathy, when they are in a particular stage, you need to see them every 2 months or every month. Some others, you can see them once in a year or every 6 months. Okay, because things can change. And it's very important that they follow the care that they are given. So those are the things I just want to point out. And it's also important if we have elderly people in our family that are not seeing very well, we should find out what is the problem in their eyes. Let us not assume it is old age. There are many people I've seen that, oh, Baba is 80, he's not seeing well. He's old, what do you expect? Or we assume it is cataract, but actually it is glaucoma the Baba has. And glaucoma has a genetic basis. So the child now, or the son I'm seeing, already has glaucoma, which is advanced, which could have been prevented if Baba has been taken to the hospital. And because usually when we diagnose anybody that has glaucoma, all the family members need to be screened, because somebody might have it already or might develop it soon. So these are very important points to note.
Wow, thank you so much, Femi. Wow. So I'm sure you're writing things down. I am, and I hope you're noting these things down. You need to schedule an eye check at your birthday every year, except you have a family history of blindness or glaucoma, then you might need to check in a bit more often, like twice a year, after your baseline appointments, and depending on the advice that your eye doctor gives you. It's important who you see. That's another thing I just picked from what you said. Be sure who you are seeing, who is making the diagnosis and who is managing you, so that nothing important is missed and you don't get mismanaged. Elderly people, don't assume they have cataracts. Let's find out what exactly the issues are, because that could actually present itself in another family member. So let's go to some more things, especially on prevention. Dr. Femi has been talking to us about the ways in which we can reduce the numbers of poor vision and blindness as a result of chronic lifestyle-related diseases. So let's go a bit more in depth. We know we need to prevent diabetes. Are there some lifestyle activities, that we adopt that will actually help to improve our vision? Do we need to learn a bit more about foods? Everyone is aware that if your blood pressure is rising, we usually say, okay, reduce your salt intake. We talk about oil. We talk about taking more fruits and vegetables. Are these things really relevant, when we're talking about our eye health? And at the end of the day, would they be helpful, adopting this?
Okay, thank you.
Yes.
So really, this has been a lot of discourse in eye health to find out all these lifestyle modifications or choices that can help to prevent blindness. Some of what I'm going to discuss are specific to some diseases and generally to eye health. So yes, there are lifestyle choices we can make. One common one I'm sure Ore has been promoting is physical exercise. So physical exercise actually is good for your eyes. This has been found to reduce the risk of age-related macular degeneration. So as people get older, there are changes that occur in the macula. This is the place where we see best in our eyes. And you find exudates or different collection because a particular part of the retina is not functioning well because of age. But if you do exercise, the risk of developing this is reduced. And for people that have glaucoma, it's noted that exercise actually lower the pressure. Moderate exercise, 30 minutes, brisk walking 3 times a week has been found to be helpful, which is the same thing WHO recommend across board. So physical exercise actually help. The other thing that has been found to help is eye relaxing meditation. Eye relaxing meditation. So Ore is looking surprised. So I call it eye meditation. Okay, so this involves you relaxing and listening to a soothing music or something that makes you relax. It's found that this actually reduce the pressure in the eye. This is because there's reduction in stress hormones, the cortisol. So this actually help. Then eating diet that is rich in fresh fruits and vegetables. Fresh fruits and vegetables. The vegetables are the green leafy vegetables. So in the green leafy vegetables, there are nitrates, which when you eat, it's converted to nitric oxide. And these actually increase the blood flow to the eye. And this helps in ensuring the nerve of the eye is well nourished and make the person better. It's also important to maintain healthy body weight. Now, when there is higher BMI and lower BMI, it causes problem in the eye. So you have to maintain a healthy body weight, like the normal BMI from 19 to 24 or 24.5, depending on which grade or scale you are using. People with higher body mass index are at increased risk of diabetes because they are obese. So the risk of diabetes is high in them. And when there is diabetes, there's increased risk of glaucoma, there's increased risk of cataract and diabetic retinopathy, which all will cause blindness on its own. Those with lower BMI, they have increased risk of glaucoma also because they have less fluid and this can reduce the CSF pressure. Now, I don't want to go into too much science because I know some people here might not be medical oriented, but the eye is an extension of the brain. What covers the brain? There are 3 layers that covers the brain, that protects the brain. They also covers the optic nerve. Okay, so if there's anything happening in the brain, it can reflect in the eye. And this is why before we have CT, MRI, usually they will call the eye doctors to come and look at the eye of the patient to know whether there's raised intracranial pressure. Because if there is in the brain, it will reflect in the optic nerve of the eye, and therefore you can easily pick this and give proper treatment to the patient. Smoking is dangerous. Apart from the effect it has on the lung, it causes a lot of vasoconstriction, reduced blood flow to the eye, and this can result in blindness. So if you're smoking, stop. If you are not, don't start. Okay, so people might read there have been this, and you might have watched news, there have been this stuff on marijuana or cannabis. It's been noted that cannabis, those that smoke cannabis, they have low pressure in their eye. It reduces the pressure in the eye up to 3-4 hours after the person has smoked. But it has not been found therapeutically to be helpful, because you need to smoke the cannabis up to 8 to 10 times a day for that effect to be sustained. So, because it has been one of the reasons some people have advocated for cannabis to be allowed so that pressure can be reduced, can be used in the management of glaucoma, but the addictive part has not helped. There have been attempts of making eye drops from it to help, but this has not been successful in that happening. The other thing is, if you take coffee, it's important to do moderate coffee intake. People that are heavy coffee drinker, they can have increased pressure in their eyes, they can develop glaucoma. So if you take coffee, take less than 5 cups a day, because we have people from other parts of the world, and it has become habitual to some people to take a lot of coffee. So less than 5 a day will be good for you. It's also important you don't take a large quantity of water in a short time. Okay? If you do take a large quantity of water in a short time, the pressure in the eye can go up. Can go up a lot. So this is very, very important to keep in mind. I've also, the other thing to mention, there are a lot of issues about nutritional supplements that people ask a lot about. It's mixed from studies. Some studies says it helps. Some other studies says it doesn't help. What is important is that you eat well, have a lot of vegetables and fruits in your diet. If you would take any supplements, take supplements that have vitamin A, C, E, lutein, and zeaxanthin. Those are ones that have been found to help. People have talked about ginkgo biloba, but it is mixed results. Omega-3 fatty acid, it is mixed results that this has brought on board. But if you eat healthy diet, you maintain your body weight, you're actually protecting your eyes. The other thing to mention is about sleep. Okay, because in glaucoma specifically, sleep have been noted to predispose people to this, especially people that have obstructive apnea or that snore when they sleep. It's been observed that when these people snore, the ocular blood flow is reduced, and therefore they have vision loss when they wake up. So people that snore, they should go and seek care. It's good if when you sleep, if you can elevate the head of your bed or sleep on a pillow or 2 pillows, that is helpful. And don't sleep with your eyes on the pillow. It's better your head is on the pillow, not your eyes. If you sleep with your eyes on the pillow, it can increase the pressure in your eye. Most of the time, moderate salt intake is advocated because when there's low salt intake, there's systemic hypotension, and once there's systemic hypotension, there's reduction in blood flow to the optic nerve. So moderate salt intake. So we have to balance what the hypertensive patients are told. Some people don't eat salt at all, and in the process, their blood pressure go low, and therefore they wake up and they can't see because the perfusion of the optic nerve is reduced. It's also important for hypertensive patients to let the eye doctor know they are hypertensive and how they use their drug. So when I see patients and I ask, oh, you are hypertensive, which drug are you on? They'll be looking at me, I've come for high. Why are you asking me about my drug? The important thing we've observed is when people use hypertensive medication, they use it, if the doctor gives them once a day, some patients use it at night when they're going to sleep. The normal BP or circadian reading, the blood pressure is low at night, between 12 midnight and 2 a.m. Unfortunately, that's also the time the intraocular pressure falls. So when the person uses an antihypertensive drug at night when he's going to bed, it lowers the blood pressure more. And therefore, the perfusion of the optic nerve is lower. And so the person will be losing fibers for vision. So cumulatively over time, you will notice it's not seeing, and it will just have optic nerve problem, and then we can't do anything about it. So we usually encourage that if they have to use the antihypertensive by 6 p.m., that should be the last time they should use the antihypertensive. If they have to use it in the evening, some people are on BD medication, so it's better they use it by 6 p.m. So the peak period would have been before 12 midnight. So the normal, hypotension that will occur will still go on, and it won't damage, create problem for the optic nerve. So this is very, very important. It's important that the patient also comply with their care, primary care that the doctor is giving to them. Thank you.
Wow. Thank you so much, Dr. Femi. You have learned quite a bit, in these last few minutes, and I'm sure a lot of us have picked up quite a bit about the things that can affect the pressure in our eyes. I'm so happy that physical activity is one of the things that can reduce degeneration in an important part of the eye. And like Dr. Femi said, please let's always make sure that we go for our walks, brisk walks, as if you are late for an appointment and you're just trying to catch up. Yeah, this is very important. So your brisk walks can improve your vision. They can prevent disease in your eye, as well as reduce your risk of other lifestyle-related diseases. I don't want to list out everything that he has said again. No point repeating them. I want to believe that you took note of these important bits of information, because what we're just trying to do here is to adopt healthy choices, that will reduce our risk of some of these diseases. So I can see that we have some questions in the chat box, and I think we'll go directly there now. Ora, if you could help me, I for some reason, I can't access the chat box. I don't know why. My screen is not just moving. So if you could just help us to read out the questions for Dr. Femi so that he can respond.
Okay, so the question from Infinix Smart 5, it says—
Oh, I think it would be good, sorry to interrupt, could you just rename yourself so we can know who you are? That Infinix Smart 5, we'll appreciate that.
Yeah, it says, "Good evening, doctor. I woke up one day and discovered that my left eye was completely blind for about 30 seconds. I rushed to LASUTH and was referred to the eye clinic. After checks, I was given eyeglasses. Still an appointment to see consultant soon. Is a risk high, as I was advised to take care of my BP and my sugar level?"
Okay. From the last statement, it's possible maybe the person is hypertensive and diabetic. I don't know what has happened. They gave glasses. Maybe there's a refractive error component in this particular person. It's possible the person, since it was 30 seconds, might have had amaurosis fugax, which is like a TIA. So transient ischemic attack, which is an early form of stroke. That might be what the person had had. I will encourage the person to see the consultant and the appointment they're given. I'm sure the consultant will take a look and give appropriate advice of what to do next. But the person should also ensure the BP and sugar is well controlled.
Okay. Thank you for that. I think you can go ahead with the other questions. I can't see the screen.
Okay. It says, "Can you please discuss more about cholesterol-related eye disease?"
Okay, so for cholesterol-related eye disease, there are different areas the cholesterol can affect. It can affect the lids. So we have people that have what we call xanthelasma. They can have yellowish deposit of cholesterol on the lids, usually in the medial part of the lids. If we see it in people 50 years and above, Usually when we sit in people, we do cholesterol tests and then encourage them to take care of it and lifestyle modification as appropriate. It can, in the young people, it could be problematic because they need proper care. The more serious things that this can create is it can create the stroke in the eye. So it can block the vein or the artery in the retina. And when this happens, there'll be sudden loss of vision, there could be bleeding into the eye, and this will need some investigation. Person might need some injections into the eye. And if it's not taken care on time, the person might lose vision. But if they present early, they can be taken care of in the hospital. Okay.
Okay, thank you. Let me scroll to the next one. Thank you for your presentation. In the case of water, how many meals within a short time can increase eye pressure, sir?
Okay, I think. Yes. So it's if you drink, we could be thirsty, and when you are thirsty, you want to drink the water. Just drink it. I think if you drink about 1 liter over 5 minutes or to 10 minutes, that might be too much. I'm not sure the precise quantity that they did in the research they found, but usually these people, they gulp water, when you've done exercises, especially. This happens when you've done exercises or you've been out for a while or thirsty. You should take your water at bit by bit. Okay, don't just rush and sometimes people just take the bottle of water and just take it bit by bit over a period of time.
Okay, thank you. I don't know, should I move on to the next one? I think we have lost Femi again.
Okay, I'm sure he will join us again shortly. The network is really fluctuating.
10 minutes, that might be more safe. That have glaucoma, it increases the pressure. Hello.
So we lost you for quite a bit there.
Okay, sorry, the network. You can see me. The network has been funny.
Okay, the next question is, good evening, doctor. I want to know how far it is true that drinking Gary can affect the eyes. I know this can sound funny.
No, don't take it as funny. It's a question I get in every presentation I'm opportune to attend. And even some of my family members fight with me. Gary does not blind the eyes. In some part of cassava, if you go to other western part of Africa, Liberia, Sierra Leone, they actually eat cassava because there are different types of cassava. Now, the cassava we have here has high cyanide content. Cyanide is toxic to the retina cells. Now, but for most people, most Gary that we eat, we usually ferment them, which reduce the cyanide content of those Gary. Okay, and so the likelihood cumulatively, even if you drink Gary or if you make Eba, you reduce the effect of the cyanide. So if you drink it, the likelihood of it cumulatively over time causing problem for your eyes, it would have caused malnutrition. Maybe from the malnutrition, the person might have, that is only Gary this person is taking, might result in issue with the eye. So it is just a myth that has taken hold in the society. Okay. However, we know now that a lot of people can grate the Gary, grind it, and make it into Gary, immediately. We should try to avoid that. the fermentation helps to reduce the cyanide content and is protective to the eye. But nowadays, there are a lot of, I was told there are different varieties of cassava in the country that has high vitamin A content you can eat and you can use for gari. So we should just know that gari does not do that. And in our part of the world, people take gari, they put granite with it. Whether they put sugar or not, the granite itself also will reduce cholesterol, okay, which will prevent other things. So there are many things we actually do when we eat the traditional food that really, if you look at the combination of things you are eating, high fiber content, vegetables is good for your eyes. The high fiber content ensures you don't increase your weight. The body takes what it needs, and you take protein, whichever protein you take. So in essence, as you live healthy, you are protecting your eyes. Thank you.
Okay, I'm sure some Gary lovers will be very happy to hear that.
So we need to be more concerned about the preparation.
Yes.
I think it's the preparation, but I've thought about it. If Gary really blinded the eyes, many people will be blind, many more people. And I think we'll have more research, that will support that evidence. So I think we're safe. I take Gary once in a while too.
Okay, I had sudden loss of vision in one eye 2 months ago, and told I have CSCR. I'm not sure what that is. I am 35 years and male. Please, can you say more on this?
Okay, I think that looks at central serous chorioretinopathy. You see it in young people. Likely, this person has a type A personality. They are very active. Yeah, it's a cause of reduction in vision. The person just noticed suddenly is not seeing. And I'm sure they did some tests. They did an optical coherence tomogram, OCT, to be able to know where the layer is. And possibly, I'm sure they might have suggested to this person to take an injection in the eye, which will help to reduce the fluid and possibly help to improve vision. These are one of the causes, or some of the causes of sudden loss of vision, apart from vascular, like I've mentioned, that can occur from hypertension, diabetes, and cholesterol. This is another one, and they occur more in young people. Other causes are in age-related macular degeneration, that this can happen. So the ophthalmologist will give you proper treatments. You'll be given some injection in your eyes, and then they will follow you up. Sometimes you might be given some eye drops that might help, but you will need an injection, and then you need follow-up properly.
Okay, thank you. Thank you, Doctor, for this presentation. My question, well, this lesson is talking about getting to that getting appointment with your ophthalmologist is quite difficult in our teaching hospitals. They've been given to.
I don't know where this person is based. I don't know where this person is based. If it's in Nigeria, I don't think it's difficult, and I don't think it's expensive. If you're based outside Nigeria, especially in Western world, I know it could be difficult to get an appointment for an ophthalmologist. Usually, people will see the high street opticians or optometrists who will then ask them, run, go to emergency and say there's an emergency. And then they can possibly see the ophthalmologist. But in Nigeria, I don't think so. It's not, if you can't afford private, and they are affordable privates, they are also expensive. I won't use the word expensive. I mean, I will say pricey. I won't use the word expensive because the environment where you go also, if you go to a place and you're like, this place is dirty, you go to a place and you're like, am I in Nigeria? So you can imagine what they've invested for you to have that. But in the country, even if you can't afford a private, you can go to the government establishment. It's affordable, you can get your care. But seeing an ophthalmologist in Nigeria, I don't think it's difficult. It's identifying the right place to go, which I understand. There's a lot of confusion. You will see 2-3 optometrists before you see an ophthalmologist. That's where the problem is. So people don't know who they are seeing. They don't know whether it's an ophthalmologist or any other person in the eye team. That's what I think is the problem. So it's good whenever you're seeing any eye doctor, you can simply ask, please, what is your CADA or what is your role, so you know what. If you see an ophthalmologist, they will tell you they are an ophthalmologist. I believe the optometrist will do the same, because so that you know who you are seeing, you have your confidence about the care that is you are being given, and you can take care of things to do. Seeing an ophthalmologist is not expensive. The prices might be different in different establishments, but I don't think it's that expensive. It's like you're seeing, mind you, ophthalmologist is a specialist, so it's not a general doctor. And I think the other thing is, in the country, people have in my own view, they want things to be free, even when you can go to private. But it's not that. The other thing I can encourage people for is you can register with NHIS. This makes healthcare a bit more cheaper. Those that are working with government, federal government and states, they have access. Or even if you're a private person, your company is not offering this, you can, on your own, go to NHIS or get an HMO. Some HMOs can allow you to pay twice or thrice, with an average of, depending on the package you pick. Before it was 25,000, father, mother, and 3 children, or 2 children. But now I think I was told it's a range of 40 to 60,000. Some will allow you to pay 3 times a year, and this will take care of all your health, eye, dental, and every other thing. It's like we do insurance for our cars, for those that do insurance, whichever one you do. You pay a little amount of money, but you can have a lot of care. So same thing for health insurance. Really, this is the way. If more people are covered with health insurance, you can walk into any clinic, any hospital to see an ophthalmologist. You're not paying anything. You'll be given drugs, even glasses, even cataract surgery, eye surgeries can be done under health insurance that you won't pay a kobo once it is approved by the HMO. It's already there. You can do eye surgeries, cataract, glaucoma, pterygium. You can get eye drops free once you are covered with health insurance. So that's actually the way for us. If we have health insurance, it solves a lot of problems. People just need to go, and it will also build the economy, because there's a pool. Not everybody will be sick. That's the truth. Of all the cars that are insured, maybe 70% have an accident. The other people have contributed to the pool to take care. So that's actually will be my advice. It's not expensive to see an ophthalmologist. Ophthalmologists are there. There might be few, definitely. There are few specialists for ophthalmologists. Most of them are in the capital city of most of the states. You see people doing outreaches to the rural areas at times. But if you seek, you will find. And if you seek well, you will find well.
I like that. Thank you so much, Dr. Femi. So if you want to see the ophthalmologist and you've actually tried and you're having challenges, you could send me an email. Send me an email at info@lifestylechamps.com. info@lifestylechamps.com, or at least you could help me to type that in the chat box. So if you know you really need to see the ophthalmologist, you're having difficulties, we'll just help you, with a referral or some directions so that we can get that done.
And they should include their location.
There is
their
somebody.
Location would be good.
Yes, your location.
Yes.
Their
location. So
location. Yes.
There is someone who would like to ask a question live. Funke Aleshinloye, please unmute yourself.
Oh, that's my aunt. Okay.
Hello and good evening. Dr. Femi, thank you very much. Co-host and host, thank you very much. I just want to make one observation. It's true, but amongst the professionals in your sector, honestly, some are very good and they will disclose that they can attend to you or they are not the one to provide you the service. I met one in 2016 who found that I had a macular hole and referred me to a retina specialist. But it is expensive. Nobody does eye surgery even on NHIS. I worked in government. You don't get NHIS.
Okay. Are we lost him,
The
ma'am?
cost
Okay.
of my question is this: even with HMOs, and that is very, very fundamental for me. I don't know if you can help us shed some light. Some of us are much older. We're in our 60s and we have our issues. And really, I'm yet to find that HMO who wants to take me on because I'm above 60. That's another challenge. So it can be pretty expensive. But that said, my questions are this. I would like for you to talk a bit about floaters, because I have a situation at hand now. I was calling the doctor today. I have some cobwebby thing in my eye. And he said, do you have flashes? Do you have floaters? For me, I'm used to those terms now, so I know what to look out for. But there are many people, because eye issues are silent. By the time you get to see an ophthalmologist, honestly, a lot of harm has been done. And there's one thing that is not common, even when you go to eye clinics, they don't dilate frequently because they charge you piece by piece for those things. So I'm glad that you're talking about it, but I know some of these things. What I'd like to ask tonight is, what are flashes? I've heard of halos and I've heard of floaters. What are flashes, or what is this cobwebby thing in the eye? It's not really a floater like I'm familiar with, and it's not halos, but there's a bit of cloudiness. I just want to say to everybody on call that if you feel that your eye is cloudy, get to see somebody. But I want you to please talk more about this thing called flashes. I just heard about that today. Floaters I'm familiar with. Cobwebby thing, I don't know. Thank you.
Okay, thank you for your question. I am very grateful, and you've had mixed experience, so I don't know what to say, but it's a good question you've asked. So flashes. Let me start with halos, because you mentioned many terms. So halos is when people see color around light. Okay, so it shows that there's increased pressure in the eye. So you see this more in people with glaucoma, and it raises a high index of suspicion that needs proper check to prevent problems. Now, floaters is when people find things floating in the air they can't pick. So something is floating. It could be like, I'm sure all of us have used firewood before. When you use firewood, you see some soot that comes up, that runs up. The fire crack, and then you see the charcoal cracks, and then you see some black soot that goes up. You can't pick it, it disappears. That's floaters. Cobwebs that people see is also a form of floaters. It can occur because of aging, when the vitreous detach from the retina. You can see it also in diabetic retinopathy and age-related macular degeneration. Now, flashes is what you see, if there's lightning and there's no rain. So you look at object and it just flash. To be as if there's a lightning and there's no rain. So they are real symptoms that people see, and they are not mad. It's just symptoms of traction of the vitreous on the retina. So there's a detachment of the vitreous on the retina. It can result in retinal detachment. That's a big thing nobody wants to see, because when the retina gets detached and it affects the macula, and you don't do anything within 100 hours, the macula is detached. The vision can be back, but it won't be like before in such people. And it is an emergency in such a case. Though the eye will be white and the person might be seeing well, but it will be an emergency. So When there is flashes, and that's why I believe the doctor asks you, the ophthalmologist asks you about flashes, it is an emergency. If you had flashes, they will ask you to come immediately for checkup, and then they will dilate your eyes to check what is the problem and look and see if there's any tear, because if there is, it needs attention immediately. You might need laser treatment, or they might have to do some other form of surgery to prevent detachment in occurring. So that's flashes. So usually how I ask patients is, do you see lightning? Arason, but ojuro. So the person can understand very well. And it is actually real when it happens in patients. So the other thing about the floaters is, if you see one, that's fine. But when you start seeing 2, 3, it was 1 before, it comes 2, 3, or it's coming in showers, that might be signs of impending detachment, retinal detachment. So it's important, when you have time, please see your ophthalmologist, let them dilate and take a look and see what's happening. And when people have floaters, we said it's because of aging. Usually we don't run after them, but if it is visually disturbing, especially if it's in the straight ahead gaze when you are looking, you might be offered vitrectomy, which has to be done by the vitreoretinal surgeon. They will just remove that floater in the back of the eye. Now, retinal surgeries are expensive. I can't tell you a lie about that. It's more than cataract surgery. So I talked about diabetic patients, we give them injection. Okay, so we have this injection that is 0.05 mil. 0.05 mil. It costs $2,000 to give one single injection. So the injection is used a lot in the Western world. They have insurances. So the people have to get it via insurance. Okay? But in a part of the world, insurance, I don't know, I think maybe NHIS covers it now, but I don't think they cover it yet. The ophthalmologists have to lobby with the drug companies, Pfizer and other stuff, to bring the price down. And to bring it down, we're bringing it down to 200,000. That is still not affordable. This 200,000 I'm talking of is 2016, 2017. When 200,000, you can buy $500. Okay? So, and that was because of a lot of people having this problem, and not because there's a market for them, but if people have the problem, they can't use the medication, they go blind. On the long run, what is the use? You understand? So, currently, I don't know how much the drug costs now, but the pharmaceutical company also have to come on board, and they have to rebrand the medication for Africa so that the price can come lower. And this is done all over the world for different medication. They make it like a generic, so it's rebranded from what they are selling in the Western world. Because if they are selling what is in the Western world, the price has to be like it is in the Western world. Okay, so people will not be buying the drug from, for example, Nigeria, and carry it to UK to go and give somebody because it's cheaper. Okay, so it's a lot, and a lot of consumables that are used, most of them have to be imported, and you have to buy them in dollars. So that's why some of these surgeries are quite expensive to do. And really, that is, when people have this problem, they need this treatment, and that's what can be life-saving to the people. Thank you for your question.
Wow. Thank you so much. Thank you so much to everyone. I think we need to round off shortly. I learned we have one more question. Someone is saying, kindly differentiate between ophthalmologists and optometrists. And I think that will have to be our last question for tonight so that we can get some sleep on time. You know, we need to avoid screens, especially just before bedtime, so that, we can maintain our melatonin levels and avoid being too alert before bedtime. So could you help us with that, Dr. Femi? Differentiation.
Okay, so ophthalmologists are medical doctors that specialize in the eye. So they can take care of medical disease, and they can also do surgery. They can also do glasses tests, prescribe glasses, and every other thing. The optometrists, they go to the university, they learn optometry, which is talking about optics, the rays of light, common eye diseases, and the treatment of eye diseases. They are called doctor of optometry. So they are also called doctor in Nigeria. Nigeria adopted the American system. So they call them doctor of optometry. They are not medical doctors. So it creates a lot of confusion because in the hospital, they will call them doctors. But what they do is they do glasses test and give glasses. They can give common eye diseases like allergy. They can diagnose and refer to the ophthalmologist to take care of further care for the patient. So that's the difference.
Thank you so much, Dr. Femi. You've really shared so much with us tonight, and I'm sure everyone has taken something home. I want to say a big thank you. This is LCI, Lifestyle Champions International, and here we raise like-minded individuals, a community of like-minded individuals who are passionate about making healthy choices every day. And today we talked about chronic lifestyle-related diseases and our eyesight. I believe that you've learned something. So right now, I feel like going for an eye check. I feel like going for an eye check. So I'm sure many of us feel the same way. You just want to have a baseline check. And then if you're hypertensive, you're diabetic, you want to make sure you check in with the ophthalmologist even more often. And if you're neither of the above, you need to prevent these lifestyle-related diseases. And we talk a lot about nutrition, we talk about physical activity, we talk about sleep, we talk about stress, we talk about your connections with loved ones and people around you. All these are important when we're talking about prevention of lifestyle-related diseases. So I want to say a big thank you to everyone. I noticed one of my ogas, Dr. Wole Kukoyi, the medical director of ACE Medicare Center. Good evening, sir. Thank you for being here. There are so many people on the call. I really want to appreciate you. Some of my colleagues are here. Thank you for joining us. If you are not on our Telegram group page, we're going to share the link so you can join our Telegram group page so that you can follow us whenever we share important information. Please follow us on our other social media handles. We are on Instagram, we're on Facebook, we are on YouTube, and we'll be sharing this video to YouTube so that in case you want to watch it again, it will be available. So thank you so much. I've been trying to look at the chat box, but I don't know what's happening with my own my function. So pardon me if I don't call out your name. So thank you, Dr. Femi. Please, let's appreciate him before he goes. Please, let's give him a big, thank you. You can clap offering, emojis to celebrate him. He's really done a lot for us tonight. I've learned so much. Thank you so much. So I can see Mr. Adediran Solomon. I can see Mrs. Aderemi Olubode. Thanks for being here, ma. Mrs. Ajibike Balogun. Oh, Pastor Akinola, Deborah, thank you for being here, ma. I can see Pastor Ariola and Urire as well. Thank you, ma. That's my aunt as well. Mr. Badmus Owolabi, Architect Idowu. I'm not so sure who this person is. It's just Bossede's iPhone. Bumi Williams, thank you for being here. Dr. Jack, thank you for joining us, sir. And then Auntie Funke Aleshinloye, thank you, ma, for being here. Mr. Benga Omotosho, I can see Fumilola too. Dr. Oduyemi, Dr. Jebi Nikawuru. Some people are not named, so I can't see who you are. Dr. Lani, thank you for being here. Idenhen, sorry, pardon me, I can't pronounce your name. Thank you for being here. Mr. Julius Makinde, thank you, sir, for being here. Mr. Kayode Olapade, thank you for joining us. Dr. Idowo Dekunle, Mr. Olaiwola Sule, Mr. Tunde Ologundudu, Mrs. Olufumini Dayo Comfort, Mr. Kende Oyewole. Thank you, thank you. I just really want to appreciate you. That's why I'm calling and recognizing you. I can see Patricia's iPhone. Thank you for being here. Pastor Bamdele Balogun, Mrs. Rachel Adeshola. Thank you, thank you. Oh, Pastor Shola Thomas, you're here. Thank you so much. Mr. Shola Ogunlola. Dr. Taiwo Makinde. Thank you, sir, for being here. Titi, thank you for being here. Mrs. Toyin Quadri, Mrs. Amona, Dr. Yetunde Fadipe. Oh, Josephine Ikise. Mrs. Josephine Ikise, thank you for being here. Thank you, everyone. We appreciate you at LCI. Thank you for following us. Thank you for being part of our webinars and our LCI panels. We believe that you're gaining something, and we hope that this has motivated you to do something about your eyesight and to have a checkup. So you could unmute yourself as we log out